Hello, hello. You know who it is. It's Dr. Nakeisha, your board certified internist and geriatrician. I got an amazing gift and I want to share her with you. So, this particular wonderful person is known on social media as the Fly Granny, and she lives up to that name. She's going to walk me through her amazing journey for getting a hip surgery, what that looked like before, her concerns afterward, and what life looks like since. So if your hips don't lie, as my hips don't lie, see you there for our next live.
Hello, how are you?
Fine. How are
Oh,
you?
it's like pink and pink. Yes. How are you?
I'm doing great. How are you?
Doing very, very well. Once again, thank you so much for doing this with us. I came across your page and I was just so enraptured. I was like, oh my gosh, she is doing exactly what I want people as they get older to do. And that's what I kind of say, age like royalty. And I was like, and you got to look at this lady. She's amazing. So
Oh, thank
I came
you.
up, thank you very much. I saw one of the videos. I think you did a video with your son and you were sharing with him the experience that you faced with the hip replacement.
Yeah.
And I want to talk to her about what that process was like.
Yes. Yes. So, and thank you, doctor, for having me on because, I love to talk about it because a lot of people suffer in silence. Sometimes I see people limping and I want to say, hey, you can get that taken care of because I was limping and it was not cute and it was very painful. And my oldest son works at the hospital for special surgery in New York City. It's one of the one of the best
Yeah.
for orthoscopic surgery. I've had joint issues probably for 20 years. It's just a part of aging,
Right.
arthritis and just, back and joint issues. But I would say about 10 years ago, it got really, really, really bad. But I was resistant to surgery because it was scary to me. Um, just a hip replacement. Oh my God, sounds like old people and it sounds really scary. And my son used to come home and tell me stories from the operating room. And
Right.
he's very animated. And he would come home and talk because they did knee replacement, total hip, back surgeries. And, at the time he was a surgical tech, he would come home and say, yeah, and the different instruments, and they saw the bone and they clank, clank, clank. And I was like, I was literally frightened, but those are special. You're totally under, of course. But
Definitely.
yeah, but when I heard that, I was like, oh my God, I don't want to do that. But I was going to get x-rays, and one of the doctors at his hospital said to me, hip replacement is in your future. And I
Yeah.
was like, God.
Did he give
And
you a time frame of how close or how many years he thought you would have?
no.
Okay.
But because I didn't want to do it, he said, okay, so we'll do physical therapy. And I was doing massage, I was working out,
Yeah.
I was going to the chiropractor. I just did everything. I was taking all the supplements and it just got worse, right? It just got really worse. And then finally, I was limping and
Oh,
it had gotten to bone on bone. And then I had another MRI
yeah.
and that was it. It was time. And then my husband had also had issues and
Okay.
he had two done. And when I saw that he was okay, I was
Yeah.
like, maybe I could do this. So anyway, so that's the long story. And I finally had it done last year.
Nice. What was, I think, the biggest, I guess, what were some of the bigger things you were concerned about before the surgery? You kind of touched on a couple of them.
Just fear of the surgery itself, to the
Yeah.
point where when I went into the consultation before surgery, I really didn't want to see all the stuff that they're going to do, but they show you the joint, what's going to happen, how they do it. And I'm like, oh God, they actually replace it with that ball. And
Mm-hmm. The
I don't know
ball
what,
and yeah.
right, right. So he showed it to me and I was like, oh God. And then my brother-in-law had hip surgery too. And he was talking about how, oh yeah, they just chop off your bone and they replace it. So I had, between my son talking about the instruments and the whatever they use, chopping off the bone, seeing this, it was really horrifying thinking
Of
about
course.
it.
Yeah.
But after seeing people recover and saying it's the best thing that they ever did and they wish they did it sooner.
Yeah,
And so
exactly.
it's true. I wish I did it sooner too. But I mean, I was right on time, but it was a scary decision, you know.
After you, so sometimes we get to see patients on the ward and round on them, and we give them things to look out for. So we've had families where, a patient will go home and they're a little drowsy or they're talking out of their head and they don't understand that that could be medication related. You can end up with like issues with, if you're on pain meds, you can become a little confused and delirious. There's always the thought of, is your home prepared for the hip surgery? Sometimes we as doctors forget to even mention that. I don't know if your doctor sat down and paid attention to things like that, like the logistics. Did you have stairs or steps and things like that? Did they kind of prepare you for the healing process?
They did. They did. They told me to get a hip kit, one of those
Okay.
kits with the reacher,
Yeah.
and the thing to help you put your shoes on. That was
Yeah.
so helpful. I didn't know anything about it, so
Yeah.
it was really helpful. Um, and to your viewers, I mean,
Yeah.
I'm surprised how soon as I was out of anesthesia, here comes the therapist. Get up, you're gonna walk.
Yeah.
I was like, what? And I got up and they walk with you and they taught me how to walk up, navigate
Oh,
steps.
yeah.
Just
Yeah.
like a little
Like a
sample
little
of few
time.
steps.
Okay. All right.
I was
Well,
really shocked that I was able to do that, slowly, but
mhm.
it's a wonderful time to be alive because I remember back in the day, recovery was real long.
Definitely, definitely. What would you say life looks, well, I see what life looks like now for you because you're a very fly. And I knew coming on today, I was like, I have to have it together to talk to her. But what would you say life looks like now post that hip surgery?
Oh man. Well, number one, the limping was horrible.
Yeah.
Even standing up, just getting up out of a chair or up off the couch, getting in and out of the car. I
Mhm.
literally had to help my right leg get in because the pain in the hip was so
Yeah.
terrible. Now I don't even think about it. I can
Mhm.
get back on. My husband has a motorcycle, so I can get back on there. It was so painful just throwing my leg over.
Yeah.
So
Yeah.
that's good. And I was diligent about my recovery physical therapy. I kept it going.
Okay.
So that really helped. And I feel so much better. I'm so glad that I did it.
Oh,
It got to the point where I was not only limping, but I
yeah.
had to, when I was in New York to get the surgery, because I did it where my son is, when I was in New York, like about a week before the surgery, I was literally walking sideways because the
Oh,
pain to walk
yeah.
was
Yeah.
so bad.
Yeah.
So it was time. And
Mhm.
yeah, and then the doctor said, you must have really been in pain. He told my son, not even me. He said, she must have been really in pain because in between, where the ball joint is, there was like all this matter like
Mhm.
spaghetti. I don't know,
Yeah.
whatever it was, that it was bone on bone, maybe but
Mhm.
that was causing me a lot of pain.
Wow. have you adjusted even like your diet and so forth, like post surgery, just in general to improve your bone health? Like, have you, kind of watched what you're eating, making sure that you're, eating more healthy?
Yes, I started strength and weight training in June.
Okay.
And that's another thing. I thank God for my son because he's been telling me for years, as you get older, you really need to strengthen your muscles because he noticed that
Uh-huh.
in the surgeries,
Yeah.
when people are not fit or not strong, their
Mhm.
recovery, number one, takes longer. And number
Yes.
two, it's like their muscles are not holding their bones together.
Yeah.
So with all these visuals that he's supplying me with all the time,
Yeah.
I'm working with a trainer now because I have
Yeah.
osteopenia.
Okay.
So,
Okay.
and I understand that's like a precursor to,
Like brittle
um,
bones, but you haven't fully gotten to osteoporosis yet. So you're absolutely right. You want to strengthen those muscles. That's excellent.
right. And then, as you get older, you just feel your muscles getting flabby. I'm like, oh my God, this does not, I feel weak. So
Yeah.
I was feeling like I was breaking down inside. So after this, I changed my diet and then I'm doing the strength training so that I can be strong. I think I may have to have the left one done eventually, which is typical,
Yeah.
but it's not as bad yet, but I'll know when it's time.
A lot of the patients that we have will recommend aquatic exercises like being in the water. Did you incorporate any of that, like any pool therapy, pool exercises?
No, I didn't, but that sounds good.
Mhm.
Um,
'Cause you're
that-
so buoyant in the water, so you're able to do a little bit more than when you're on land. So that's something that we like to recommend to people.
so in your practice, are you doing hip, knee, all the surgeries as well?
So I'm actually a geriatrician, and with that, I'm more internal medicine. But
Oh,
where I segue in is, I see my patients on a monthly basis, and we also teach residents. But I'm trying to get them to really open up their eyes to look at aging in a different way, because I'm realizing they're treating a lot of their patients that they're seeing in the clinics and on the wards are over 60. And so you have to kind of put on a different type of lens in order to manage correctly. So we see a lot of patients going to surgery for like back issues, knee issues, hip replacements. And if you're not looking at the whole person in its entirety, there's a lot of things you can miss. We try to teach, patients to really, I believe that the more knowledge you have, the more you could advocate for yourself and the more your families know what to look for. So when they come to visit you in the hospital, they know, what things they can do to kind of reduce the chance that you'll end up becoming delirious and the chance to have a longer hospitalization. I'm sure you were familiar after the procedure with the complications of like blood clots. And I'm
yes,
sure what did they
yes.
tell you about that in terms of what to do and what to take to prevent any blood clots?
Yeah, they gave me about four different meds, one for pain, one for the blood clots,
Yes.
um, uh, one for your stomach, I think, because some people have issues or constipation after
That's
anesthesia.
right.
And then
Mm-hmm.
there was another one, I can't remember, but
Okay.
I took all of them. I don't like to stay on painkillers, so I
Right.
think I was on it for 2 days, and the pain wasn't as bad as I thought it would be, thank God. So,
Good.
so I just wanted to wean myself off because I didn't want to, be addicted to any painkiller. And then, also I could tell how bad it was if I,
Yeah.
or how if it's getting better. So,
Yeah.
but they're very good about keeping me informed, what to do. And then I have
Yeah.
physical therapy at the house right away.
That's
So
nice.
yeah, so that was really good.
And how
But
often did it, like maybe twice a week or once a week? If it's
she came at first twice a week, I think. Yeah,
mm-hmm.
for about a month. No, 3 times a week for a month.
Okay, that's good.
Yeah, so that was good. And then, like I mentioned, I continued to do the exercises because I felt myself improving,
Mhm,
And I still
mhm.
do some of them now, like the marching ones, because
Yeah.
I couldn't get my knee up at first, and now, it's like almost 100%. So I'm in a community where there are a lot of mature senior
Mhm.
citizens and
Sure.
other people who've had hip replacements. And I tell them to keep doing it because I think it makes a big difference to keep
It
doing
sure does.
the
Mhm.
exercises.
Definitely. What advice would you give to us as physicians as we because we're all aging and and I look at it as evolving, not aging. And I look at it as you becoming your better self. You get more wisdom, you get more
Yes.
experience. So what advice would you give us as we, take care of persons, more mature patients in terms of how should we interact and what should we do in terms of our bedside manner, or how we talk to the families? Any pearls you could give me?
Everybody is a different scenario, as you know, everybody is totally different. But in my silver community, we're approaching it as pro-aging, not anti-aging. So
Yeah,
that's the buzzword, pro-aging.
I like
And
that.
yeah, and it's I'm more content with myself than I used to be. So maybe just treating mature people like it's not the end of the road. It's like
Yeah.
you're beginning and you can always begin again, right? Like I think um some people get so set in their ways and
Mm-hmm.
they don't think that they can try new things and reinvent themselves.
Mm-hmm.
And I think if healthcare professionals would maybe talk to them in a way that it's not the end of the road, not don't put a band-aid on it, and live your life. And there are great options now to
Yeah.
live a more fulfilled and better life.
Mm-hmm.
Um, I hope I'm answering your question. The healthcare area that I had, I think the worst experience with, believe it or not, were gynecologists, because I
Mm-hmm.
felt like they weren't hearing me and I felt like they weren't listening, right? Like to my needs. Now I'm postmenopausal.
Yeah.
This is not, maybe it's related to, and I hope this will be helpful. But, I would tell them, I'm feeling tired, the vaginal dryness, everything, it's just reality. This all happens postmenopausal.
Sure.
And I felt like I wasn't getting heard. It's like, oh, just try this cream. Well, that cream didn't work. Well, just try this other one. Nobody said to me to get a hormone panel to see exactly where my levels were and
Yeah.
address it until recently. I found
Okay.
she's actually a nurse practitioner. She ordered a panel. But what I'm
Yeah.
saying is to listen
Yes.
to the patients and work with them. Also, I was very happy with whoever was willing to listen to my holistic leanings, right? I
Oh,
don't want to always
yes.
take meds. If you have a
Yeah.
supplement that you can, and don't always like tell me, oh, you have to take this. That's not good. Why didn't you do the? And
Yeah.
because I'd rather go the natural route.
Yeah.
So, if anything, work with people rather than reprimanding, because then they're not going to tell you the truth. Because I know people who say,
True.
I don't tell
Yeah.
my doctor I'm taking this, but it's
Mhm.
working.
Yeah.
So,
That's
you know,
excellent. That's
yeah.
excellent. If you could go back and I guess talk to yourself, and I've seen you do it on your videos before, but if you could go back and give yourself advice for preparing to be healthy as you get older, are there things you would have told yourself years ago?
I think I would have started strength training and lifting weights earlier, because, we come from the generation of aerobics and,
Mhm.
cardio. And
Yeah.
now there's a lot of studies showing that strength training is actually better for you, for longevity, for your bones, for your health. So I would have been doing some weightlifting. I was always afraid of gaining weight, and I was always afraid of being too buff or whatever. But you can just do it in moderation. But that's what I would have done 20 years ago, just the strength training.
What would you say are like certain nuggets? Do you have a way that you kind of structure your day? Because I believe it does come from inside. We could look beautiful on the outside, but it does start inside, with your personal relationship, your meditation time, your spiritual time. Do you have like a set routine that you're like, I have to do this in order for me to really function?
I'm not that organized, but but I do pray a lot,
Yeah.
most mornings, not every morning, most mornings I'll journal and I'll sit and I'll meditate, and it's really helpful to pour out on paper and get it out so that you can go and take care of, it's not hanging over your head. So that and prayer really, really helps relieve the stress, because that God, or your higher power, God, is
Hey, God, Jesus. Yep.
Amen. Amen. God, that the Lord
Mhm.
is just taking care of things behind the scenes, and that you can, because some women are like, how is your skin so good? How come you don't have wrinkles? And I'm like, you know what? I cast my cares on the Lord. That's the
Amen.
main thing. So we
Yeah.
just leave them there. They don't go away, but we know that He's handling them, so that's number one. I've been working out at least 5 days a week. Must work out, because the minute I don't, I start, unlike when you're in your 20s and 30s, I start getting flabby if I don't work out in 2 weeks.
You feel a
So
difference immediately? You think you start to feel a difference?
I
Okay.
can feel like the muscle already,
Yeah.
converting to flabby. And it's unbelievable. So we have to keep at it.
Mhm.
I also try to learn new things, because I also learned that, it helps your brain neurons.
Yes.
My brother unfortunately had a stroke,
I'm
and
sorry.
years ago,
Okay.
but he hasn't recovered. And I keep talking to him and telling him, you know, don't listen to the same thing over and over. Watch something new, because he's watching Blue Bloods every day, every time I'm talking to him. And I'm like, put something else on so you can, stimulate.
Yeah.
So I just try to stay relevant. I try to stay aware and alert, and I try to stay in tune with my body. But anyway, and that's part of my daily process too. So yeah.
That's awesome. That's
Yeah.
awesome. So now you bring up my final question. When we say age like royalty, because I think you personify that, what does age like royalty mean to you?
Okay, I guess it means like taking it on and
Yeah.
accepting yourself, because this all really happened with my gray hair, right? I was not accepting myself. Well, it's a youth cultured society, and it's dyeing my hair for a very long time, and then I suddenly let it grow out, and then when I let it grow out, I'm like, hey, this looks okay. And when you accept yourself, I think the world responds to you in that way, because I didn't care anymore. I just let it grow out. And before I was worried, oh, I'm going to look old. I'm going to, so the minute I embraced that, my hair, I just kind of was like, hey, I'm older. I can still be fly. I can still do these things. Right.
Mhm.
And so embracing it is
Yeah.
part of, and being comfortable with it
Yeah.
is a big part of it. So yeah, I think that says it for me.
Awesome. Awesome. Thank you so much. Oh my gosh.
Oh, you're
Thanks.
very welcome. You're very welcome. Thank you so much. Thanks for having me.
Thank you. And you take care. God bless.
You too. God bless. Bye-bye.
Okay. Bye-bye.